The pandemic that changed the world and is still affecting hundreds of millions of lives. Yet out of those who recovered from infection, a number succumbed to another phenomenon, post-COVID syndrome. Like the majority of those diagnosed with long COVID, Shani Wright wasn't hospitalised. Yet 2 years on, a lack of understanding about post-COVID syndrome has left him dealing with a condition that impacts his daily life.
There are no effective treatments for the illness itself. All doctors can try and do is target specific symptoms, but most of the symptoms, they have no treatments. It's also the lack of understanding around the condition. Doctors have very little insight into what the underlying drivers are.
From a personal perspective, dealing with post-COVID syndrome has been a very frustrating experience. It's debilitating and also extremely unpredictable. And even though the relapses become part of day-to-day life, it doesn't make it any easier to deal with, as so many of us can confirm. And while researchers are at the forefront of trying to find a treatment, they say that there needs to be a drastic rethink in how we deal with this on a societal level. Rob McNellis is a physiotherapist helping patients with long COVID and is himself living with the condition. He has seen a rapid rise in those seeking help and knows how it's affecting those who are trying to return to normal life, to their employment, only to relapse through the effort.
They can do things, it's just that the things that they do take a toll on them. It's really about getting people to ease back from the intensity that they're doing, whether it's working different patterns, so that they're maybe working 2 days a week, but they are experts in their field and are paid accordingly, so they're not having the financial hit, because lots of people are feeling that they're really struggling financially now.
Grassroots groups have also been crucial. Journalist Noreen Jamil set up a podcast, The Long COVID Sessions, for patients desperate for support. It's now being used by health practitioners as a source of information.
You know, we're looking at 1 in 5, according to the CDC, of people developing a post-COVID syndrome. That there's a massive cohort or long COVID community that are advocating for themselves.
Meanwhile, the increasing numbers are requiring defined strategies, like those put in place at the start of the pandemic, to deal with post-COVID syndrome, while those affected wait for an answer to this mass disabling event. Sonia Gallego, Al Jazeera, London.
Let's bring in Caitlin Jetelina. She's an epidemiologist and assistant professor at the University of Texas. She joins us now from San Diego. Thanks for being on the programme. How concerned should we be about long COVID?
We should be concerned. Long COVID among adults is common and it's broad, and its impact on the body, and it's making it very difficult to not only diagnose long COVID, but also study it and find treatments. But what is clear is that it's going to be a major public health problem and will contribute to the health footprint of SARS-CoV-2 for years to come.
So what have we learnt so far in terms of the way long COVID needs to be managed?
Yeah, just like you heard a couple of minutes ago, we don't know what's really causing this. It could be because of viral reservoirs in the body. It could be because the immune system and people are just in overdrive and have a tough time calming down after COVID-19 infection. We don't know what's really causing this, making it very difficult to find treatments. So currently the approach is comprehensive treatment. So having multidisciplinary groups of doctors to help treat people, as well as treating symptoms. Unfortunately, we are yet to treat the underlying cause yet.
Now, at the moment, there's alarm over monkeypox, isn't there? I mean, does the COVID experience give us any kind of head start, as it were?
You know, you would hope so. I think that the United States right now is somewhere in the middle between being prepared and being unprepared. Just like COVID-19, the monkeypox outbreak in the United States is really highlighting our neglected, our underfunded, and our really fragmented public health system in the United States. It desperately needs fixing, like data, like communication, like bureaucratic coordination, like trust. And fixing this is complicated, it's expensive, and more importantly, it just takes time. It cannot be fixed overnight. Regardless, it has been very difficult to watch. But I think it's important that we're not starting from scratch. We've spent the last 30 months creating systems, building capacity, and we really need to reactivate these or adapt to these efforts to pivot towards monkeypox. We also really just need to be more aggressive, or at least faster, in the federal response. We can no longer have this wait and see method in the United States.
So what extent will vaccines continue to be the weapon of choice for governments?
I think it will still be the weapon of choice, whether it's COVID-19 or monkeypox. And one of the reasons for this is because it does a very good job of preventing infection and then preventing severe disease and death. It's one of our strongest layers of protection. Unfortunately, it's not 100% protective, and so we need other layers, like secondary layers like masking. But I'm very confident, and I think that's the right approach, and taking a #1 priority to vaccines.
Okay, Caitlin, Jetelina, thanks very much for joining us.
Yeah, thank you for having me.